Hello everyone, myself Sharin Neetal Dsouza, Associate Professor, Department of Child Health Nursing, Yenepoya Nursing College. Today we are going to discuss regarding weaning and complementary feeding. Learning objectives of this session are define weaning, enlist the purpose of weaning, explain the principles of weaning, enumerate the advantages of weaning, enlist the qualities of weaning food, explain the contraindications and its consideration, list down the complication and its prevention. Weaning is the process of gradually introducing complementary foods or liquids to an infant's diet, like till 6 months of age. Infant is fed only exclusively breastfed or breast milk. That's why we need to transit the infants from exclusive breast milk to the semi-solid or solid diet in the form of weaning. So it marks the transition from exclusive breast milk feeding to a more varied diet that includes solid or semi-solid foods. It is the process by which an infant gradually becomes accustomed to adult diet. We'll see the definition of weaning. Weaning or complementary feeding is the process of giving an infant other foods and liquids along with breast milk after the age of 6 months, as breast milk alone is no longer sufficient to meet the nutritional requirements of growing baby. Like, we require to give a baby various nutrients such as iron, zinc, or maybe the fatty acid, or maybe the calcium. So it is very essential for growing baby for the normal growth and development. This will be given along with the breast milk or maybe the formula feed. Let us see the purpose of weaning. The first purpose is nutritional transition, like supplementing the milk. Breast milk or formula milk itself is not sufficient, as I said. That's why we have to give the weaning in form of liquid or maybe the semi-solid or maybe the solid diet for the normal growth and development of a child, and delivering the dietary diversity. As the child grows or as the infant grows, they need to develop their sucking, swallowing or maybe the chewing skills, and their tasting buds need to be developed very well. For that, the different texture or maybe the flavors they have to recognize. For this purpose, we have to give them different variety of foods. The second purpose is developmental advancement, which has oral motor skill development. Oral motor skill enhancement is very necessary. Why? It will happen only because of chewing or swallowing, like which will be strengthening the oral muscles. And sensory exploration, which has child need to be recognized various texture, flavors, smell, so that his cognitive development will be increased. Then the physical development. Various calories are very essential for the normal growth and development along with other nutrients. So normal proper growth and development which is required for the baby to have other food other than the breast milk is essential. Social and emotional development indicates the family meal participation. As the infant grows, the infant will be mingling with the family members, like table manners will be developed, interaction will be developed, and proper communication skill will be enhanced. Then family members will be cuddling the child, as well as the bonding will be increased. Next one, independence and self-feeding. So as the child develop the table manners, child will be restricting like intake of food. So that is enough for me, or I do not want, or child will be starting with the finger foods, like maybe a small piece of cucumber or maybe a small piece of banana, etc. Child will be picking from the fingers and will be having. The next one, it is a transition to the family foods. At the 1 year of age or maybe extending to that, child will be adapting the family meal system like to solid diet. The next purpose is preparation for future dietary needs. Establishing the healthy eating habits, like avoiding the unhealthy eating habits as well as a dietary pattern, and adapting the solid foods. Let us see the principles of weaning. The first principle is gradual introduction. So, baby need to be fed gradually. We should not force the baby to take the food. Like, we should administer the weaning diet one by one, slowly and steadily. One food at a time we need to give. So, why we are giving the one food at a time means to know the allergic reaction. Child may be having some kind of allergic reaction. To avoid that, we should be administering only one food at a time. Then the progressive texture. Child should be able to recognize which is the favorite food, like the texture, the flavor as well as the smell. So depending upon the individual child, we need to prepare the food and we have to give according to the taste. The next principle says responsiveness, which indicates like infant-led feeding. As I said, which food is liked by an infant will be given more or will be given the more importance. Positive feeding environment. We should avoid or we should give relaxable, enjoyable environment. We should avoid the distraction. So child should focus on the food. Next very important principle is the safety. Safety is very essential, that is to prevent choking. Why? Because whenever we are administering the food, we need to take care. We are not supposed to administer any raw material. Properly chopped and cooked material only we need to give for the child to avoid choking. Then whenever we are preparing the food, we have to maintain proper hygiene like washing the hands, washing the utensils, etc. Then allergic awareness. As we administer the food for the infant, we should be able to recognize the allergic reactions for such as maybe child will be having some allergic reaction like rashes, etc. Nutritional adequacy, that is nutritional dense food. So what is this nutritional dense food? It is like whenever we are feeding the baby, we need to be focused on iron rich food to prevent the iron deficiency anemia. Along with that, vitamins as well as the calories and the essential fatty acids we have to give for the baby. Continued milk feeds. Along with the weaning diet, we have to ask the mother to feed breast milk and formula, breast milk or formula feed. Then avoid unhealthy additives like excessive adding of salt or maybe the sugar or maybe honey or frozen foods we need to avoid. The next principle is developmental appropriates. Age appropriate food only we need to give. For example, if at all is a 6 month very thin puree, then gradually as the age advances like thick purees, then the solid diet we should be given for the infant. Individualized approach. Every infant is unique, everybody's taste is not similar. So every individual we need to consider whenever we are preparing the weaning diet. Parental guidance and support, it is very essential for the parents if at all they have got any doubts. For example, in case of cleft lip, cleft palate, it is very essential to receive the education from the professionals like pediatrician or maybe the dietitian. So professional consultation can be done by the parents to gain more knowledge. Let us see the advantages of weaning diet. For the infant, nutritional adequacy. So whenever we are giving the feed for the baby, we have to make sure all the nutrients are involved. Like kind of balanced diet only we should be giving. It is not like that focusing only one ingredients or maybe only one material or maybe only one nutrient. So we have to focus other things also. Then the developmental benefit, as the growth and development it is occurring within the infant, so we have to focus to have the calories, vitamins, etc. Immune system development. Immune system need to be developed, that is true. Immunity need to be enhanced or we need to boost the immunity, so that proper food taking is very essential. Then adaptation to the solid food. Advantages for the family. The first one, it is the increased independence. As the infant is sitting along with the parents on the table to have the food, so infant will be developing control over his intake. Then the family meal integration, like maybe enhancing the communication, the bonding, the discussion, etc. Flexibility and convenience. This is very important or it is very benefitable for the working parents. Like if the infant is adapting or is able to have or able to take the weaning diet, it is very much good for the parents. Improved sleep pattern. If the infant is very well fed during the daytime, so night time a healthier or sound sleep we can expect from the infant. Then the social development. Maybe the sharing, communication, etc. Cost saving. Whatever food we are preparing in the family, the same food we can give for the infants rather than purchasing the formula feeds, etc. Let us see the qualities of weaning diet. Like first we have to administer the liquid diet followed by the semi-solid, then the solid food. It should be very clean, very hygienic so that no infection can occur. Easy to prepare at home and that is not so costly. Contains all the nutrients. It should be well balanced, nourishing and suitable for the infants. Let us see which kind of weaning food we can give for the infants with few examples. I said liquid, semi-solid as well as the solid diet. Like liquid, few examples, rice water, juice, oatmeal etc. Whereas semi-solid, pulses, boiled vegetables, mashed banana, mashed potato. Solid diet like a fruit as well as a vegetable, maybe the rice, bread etc. Now let us see the weaning food according to the age group. At the 6th month of age, we are going to start the weaning diet or often closer to the 6th month. So we have to give a single ingredient purees. For example, they are very smooth and very thin. Iron fortified single grain cereals like rice, oatmeal or maybe the barley. Then the pureed vegetables like sweet potato, carrot, peas or maybe the butternut squash. Pured fruits like apples, pears, banana as well as avocado. 6 to 8 months we need to expand the variety of the foods as well as the texture, so that we have to administer thicker purees or maybe the mashed food or maybe the finger foods such as a piece of mango or maybe a cucumber etc. we can be given. 8 to 10 months, still we have to increase the texture and variety of the food. The food should be much more thicker like a lumpy, mashed or maybe the fine chopped food which is very well cooked. We should not be given raw food without cooking like a pea or maybe a small food particles which may go and obstruct the respiratory tract. Again a choking will be visible. Then we have to give the finger foods including all kind of fruits, proteins or maybe the vegetables. 10 to 12 months transition to the family food, in the sense the baby can be having the food which is other family members are consuming, like variety of the textures as well as the flavors, like small pieces of cooked table foods or maybe the egg which need to be cooked or boiled thoroughly, then the cheese or maybe the upma, rice etc. But few important consideration we should be giving whenever we are feeding the baby. We have to focus on the iron rich food, that is to prevent iron deficiency anemia. We should be aware regarding the allergic reactions. Choking hazards, as I said, a small pea or maybe some food particle may go and obstruct. So close observation and monitoring is very essential whenever we ask them to take the food, especially while giving the finger foods. Then the individual differences, professional guidance, if at all it is essential, we can seek. Then hydration, in between the weaning diet or maybe in between the meal, we have to give a small amount of water to prevent the dehydration. Then whenever we are preparing the food, we have to be maintain the well hygiene or hygienic practices. There are few contraindications where a weaning is not that possible. In the case, severe illness or infection, like maybe the acute illness or maybe the chronic illness such as a respiratory infection or maybe the gastrointestinal as well as the cardiac problems. Then the premature birth where sucking and swallowing coordination is not well developed or developmental delays. Some kind of neurological conditions where swallowing difficulty we can see in case of cerebral palsy or maybe the aspiration risk. Sometimes the child is having the severe food allergies or gastrointestinal disorders like malabsorption or reflux, that is GERD, or maybe oral motor dysfunction where the child is having cleft lip as well as the cleft palate where they cannot be able to chew the food. Then the next contraindications like a failure to thrive where some kind of underlying conditions as well as the nutritional deficiencies like certain metabolic disorders like phenylketonuria or maybe the galactosemia. Then immunodeficiency where increased infection risk rates. So these all are the contraindications for the weaning diet. So what we can do, which all are the general consideration we need to focus to avoid this or to overcome this. Consultation with professionals. So parents can consult the professional to seek the guidance how they can go about, or maybe the individualized approach, like each child is unique, so we need to give the individualized approach. Then close monitoring to prevent the aspiration or maybe the allergic reaction or maybe the choking. There are few complications for the weaning diet like choking, allergic reaction, digestive issues, sometimes the nutritional deficiencies if at all we focus only one kind of nutrients, then the food refusal from the infant, then the oral motor problems like the chewing and swallowing coordination is not well developed, or maybe the infection risk, emotional and the behavioral issues where the stress as well as the anxiety about the weaning food, or maybe aspiration and dehydration. How we can prevent and how we can manage these kind of complications, like first liquid is starting, then semi-solid and solid food to be introduced gradually, easy to prepare at home with the available food items, easy digestible, acceptable, palatable for the infant. A small amount of the new food should be given in the beginning and gradually the amount of the food to be increased during the course of a week. New food to be placed over the tongue of the baby to get the taste. A single food is added at a time. Additional food can be given in the daytime. New food should be given when the infant is hungry, but never force the child to take the food. Observe any allergic reaction. It can be started 4 to 6 months of age and continued up to 2 years of age or beyond. So to summarize today's session, we have dealt definition of weaning, purposes of weaning, principles of weaning, advantage of weaning, complication and its prevention, qualities of weaning food, contraindication and its consideration. To conclude, breast milk is not sufficient to meet the nutritional requirement of the baby after 6 months of age. So, weaning is a gradual process of introducing complementary food to an infant while reducing the breast milk or formula intake. So, weaning emphasizes a gradual, responsive and nutritionally sound approach to introducing the complementary food. Thank you.